Hello, Facebook. We're going live. It's my first time at Southern Comfort Marijuana Clinic. This is Dr. McCain, and I'm coming because I need to talk about your patient rights being violated right now, even in the state of emergency that we're in. As of right now, 5 p.m. on Monday, the executive order which allows telemedicine for cannabis patients is going to expire on Wednesday morning. Just to give you a little bit of background information, medical marijuana became legal in Florida in November of 2017. That's when 71% of the voters said, yes, we want to allow our patients access to this medicine. And I've been practicing ever since it has become legal in the state of Florida, so I've seen the progression and the politics that have followed with it. In March of 2018, the Board of Medicine in Miami, and I attended this meeting, decided without minimal discussion, without really much discussion, that this type of medicine is just prohibited to be practiced with telemedicine. And this was decided by the Board of Medicine, a bunch of physicians, none of which hold a medical cannabis certification. So telemedicine has never been legal in the state of Florida, and we understand that. But when the executive order happened, we are in a state of emergency because of COVID. The president, the CDC, the national standard of care right now is to do telemedicine to avoid contact, avoid the spread of disease. And we need to keep our staff safe. We need to keep patients safe, especially patients who are more prone to illness. And those are the ones that are coming to our cannabis clinic. Our patients are debilitated patients who have chronic medical conditions. That's by law. So what the executive order was, it was issued in March of 26, I'm sorry, it was issued, March 16th, of this year, by the state surgeon general. And he said that you're only allowed to do telemedicine for recertifications, patients that you've already seen once before and who you've already certified. So first of all, that cuts out a big portion of new patients that have not yet been exposed to medical marijuana. That aside, the real problem still exists. That two things. Number one, that means any physician that was hired in the preceding 7 months can't work by telemedicine because they wouldn't have any recertifications up for renewal. So we had to lay off at Southern Comfort Dr. Nick because we're not going to ask him to work against the laws. And he is not allowed to work within our clinic to see my patients, even though he has access to the same notes and the same information that I provided patients. If anything, patients have the service of having two physicians give them consult. But anyways, Dr. Nick Lazama, he is working the front lines with his military background. He is an emergency operations consultant in Jupiter. So I'm glad he's found a purpose and he's serving a void in the COVID. But he can't work in the medical cannabis world right now because he doesn't have any recertifications under his care yet because he was hired within the last 7 months. Now also think about this. What if the patient has been on medical cannabis and they gave up their benzodiazepines and they gave up their pain medicines and they're doing really well on medical marijuana and they're not suicidal and their disease is under control, but all of a sudden they have no access to medicine because the physician they saw previously, which by law is they're required to return to that physician, taking away the patient autonomy, the right to decide who they see as a physician, they can't. They're only allowed to see via telemedicine the physician who saw them previously. What if that physician fell ill and they are not caring for patients? What if they just don't even do telemedicine? What if that physician doesn't work for the same company anymore? What if? The problem is that these are patients who are going without medicine. There are new patients who are denied access to care via telemedicine. And I understand that telemedicine was not previously allowed, but we are in a state of emergency. We are in a state where the standard of medical care to protect our patients, to protect our healthcare workers, is to do telemedicine. And honestly, especially for recertification, we don't need to see patients in office. Now, are there doctors that are still keeping their doors open? Yes, because they have to follow the letter of the law and they have no other choice but to keep their offices open, but at a risk of all of what I've just mentioned. So we are asking if you can help us be advocates. The medical marijuana field is very narrow and it's not very agreeable to a lot of clinics. I'm coming out of my primary care clinic to serve the void in the cannabis world right now, and that's not right for me to have to choose between patients because I had to let a physician go because he can't work. I have written letters explaining these concerns to the state surgeon general, the Board of Medicine, the Department of Health, Courtney Coppola, state representatives Dolores Johnson and State Senator Gail Harrell, all of these people have not yet once even responded to my email to at least acknowledge that there's some limitations and that they will at least keep it in consideration. I've emailed as well as the Florida Bar, and I've left a call to the Florida channel where the governor and the state surgeon general just had their press conference about the COVID crisis. And again, I'm not really sure what more I can do as a patient advocate, but I want you to be aware that behind the lines we're working and we're trying to help get our patients access, help get patients who are left behind access to care. And I think we need to collaborate and come up with a better way to let medical marijuana patients know that you are patients and you are accounted for, and you should not have any limitations, for your medical care that the next patient does not have. And we are supporting the use of telemedicine for future as well, but at least for patients who are existing in the system, please let them do telemedicine. And please give us an idea of what our business model should be in a day and a half. We don't even know about my staff telling them what our operations are going to be come Wednesday morning. So we are at the mercy of the state, and we are just letting everybody know that the limitations exist right now, and we are doing the best we can to be your patient advocate and your medical marijuana cannabis clinic. Thanks, guys.